On your ABC 31 Medical Minute, we are at Hartner Medical Center in Alla, Louisiana, speaking with family nurse practitioner Jorie Sanford. Hello.
Hi.
Tell us about yourself, where you're from, and what schools you attended.
Okay. I grew up in Winsboro, Louisiana, which is not too far from here. I graduated from Winsboro High School.
Okay.
I went to nursing school at, it was Northeast Louisiana University. It's called ULM now, but shows my age a little bit, I guess. And then I went to nurse practitioner school at Northwestern State University.
Okay. Let's talk about mid-level practitioners, particularly nurse practitioners.
Okay. Well, a nurse practitioner, I'm a family nurse practitioner, but I'm a registered nurse. And then I went back to school and received more education and training to be able to function as a nurse practitioner. So, and basically in the clinic setting, I can diagnose, I can treat, I have prescriptive authority to where I can, prescribe medicines and, basically can come and function in the same capacity as a physician. So,
It seems like the advanced nurse practitioners are being utilized more in the medical field. Why do you think that is so?
Well, when nurse practitioners first came into being, they were really to help get a provider or to more rural areas because it was harder to get physicians to come to the more rural areas. So, but now, we have them here, even in this rural area, but even in the bigger cities, the more specialty practices and even, the practices there are utilizing them because I think it helps to, one, it helps to expand the doctor's practices, and it helps to helps them with their workflow. Because some of them even make rounds and do stuff like for them in the hospital. So.
Okay. You are a board-certified family nurse practitioner.
Right.
Who is the accrediting board, and what does this mean to the public?
Well, when in the state of Louisiana, when you graduate from nurse practitioner school, you have to take a certification test, basically to pass that to be able to practice. So the one that I took is from the American Nurse Credentialing Center, or the ANCC. Okay. So basically that just kind of helps, it should help people to know that when you pass that test that you kind of have a basic level of knowledge and that you can function as a family nurse practitioner, kind of that you know what you're doing.
Yes, and getting into that scope of practice, it's a wide scope of practice for family nurse practitioners, isn't it?
It is.
What's some of the diverse treatments for the patients?
Well, as a family nurse practitioner, I think it was real appropriate for me to be, here in a rural setting, just because, I may walk in one room and see a 2-week-old, and then I may walk in the next room and see a 80-year-old. The next room may be something completely different. So I think with the scope of a family, I'm able to treat all people in the family of all ages, with all different kinds of problems.
This has been your ABC 31 Medical Minute from Hartner Medical Center in Alla, Louisiana. I'm Lola Davis Michels.